So this is the ulnar bone, which we can see in isolation. It sits within the forearm alongside the radius. And we can see we have a number of views here that reveal various bony landmarks. So let's have a look. The ulna is longer than the radius, and within the forearm it is involved in stabilizing the forearm, and of the two bones it's positioned medially. So the ulna is medial and the radius is lateral. Here we can see the anterior view, here we can see a posterior view, and this view is if we're looking at it from the radius. So as if we're looking at it from the radius's position. We can see it's really a lateral view as if we were the radius. And we've got some features which I'd like to detail. So proximally up here, we have the olecranon. We can see that here on the posterior surface, and here on this lateral view, we can see the olecranon. And that proximal kind of extension of the ulna helps to form this C-shaped cavity. And this C-shaped cavity is known as the Trochlear Notch. We can see we've got the Trochlear Notch here. We can see we've got the olecranon, this C-shaped notch, which gives rise to this coronoid process. Now, if you remember, on the anterior surface of the humerus, we had the coracoid fossa. Well, the coronoid fossa. Well, this enables the coracoid process, to sit in it when the forearm is fully flexed. So we can see the coronoid process here, when the forearm is fully flexed, so the forearm is sitting against the arm, the coronoid process can sit inside the coronoid fossa, and that adds stability to the flexed forearm. So we've got the olecranon, which we can see, we've got this C-shaped trochlear notch, and we've got this coronoid process. The trochlear notch is going to articulate with the humerus. Okay, specifically the trochlea of the humerus. So we've got this kind of barrel-shaped trochlea of the humerus, and that is going to allow articulation with the trochlear notch. We can also see the coronoid process. We can see it here on the anterior process. We can see it here posteriorly sticking out somewhat. Laterally, we can see we have the radial notch. We've got the radial notch here on this anterior view, and we've got the radial notch here on this lateral view. And that's important because that's going to receive the head of the radius. We also have this crest running down here known as the supinator crest, and that offers the attachment of supinator muscle. More inferiorly from the coronoid process, we find we have the tuberosity of the ulna, and we'll come back to that in a moment. So some important bony landmarks we can see on this proximal region of the ulna. If we look at the shaft of the ulna, then there's not a great deal to really mention, just that it has a sharp interosseous border. So here we've got the anterior view, we've got this anterior surface running down here, and we can see we've got this sharp interosseous border. We can see it quite prominently here on this lateral view. The interosseous border is important because it allows the interosseous membrane to run between the radius and the ulna. Distally, if we look at the ulna, we have the head, a rounded head, and then we have the ulnar styloid process. And this sticks out, we can see here on the posterior surface, we can see it here, and on this anterior view, we can see the ulnar styloid process sticking out. And this can be palpated medially at the wrist joint. The distal end of the ulna does not articulate directly with the carpal bones. There is an articulation there, but it's separated by an articular disc, and we'll come back to that when we look at the joints.